She practices general and surgical dermatology for adult and pediatric patients. Her focus is on providing individualized care, addressing the physical and emotional impact of skin disease. She graduated summa cum laude from Macaulay Honors College at CUNY Queens, studying neuroscience and studio art, and got her medical degree from SUNY Downstate College of Medicine. Dr. Wertenteil enjoys exploring Long Island parks and museums with her family in her spare time. Thank you so much, Dr. Wertenteil, for joining us today.
Thank you so much for having me here. It's good to see some of you, and it's good to be here with everyone. So today, I'd just like to quickly say that I'll be going over in particular what acne is and what causes acne. And part of the reason why I'm so excited to be here tonight and talk to you guys about all this is because, you know, it's not just that acne is something that I see all the time, like as a practicing dermatologist, we see this every day. But more importantly, it's because it's just a really good example of, you know, what brought me to dermatology in the first place and what I love about dermatology, which is that, you know, when a person has, you know, any kind of skin condition, it's not just that they have, you know, some kind of isolated, abstract medical condition, you know, like heart disease or blood pressure, but it's actually something that they can see on their own skin. And, you know, they see it every day when they look into a mirror, and it's something that everybody around them sees too. So that's what, you know, creates this profound impact on their lives from their skin condition. And it's something that affects people's lives every day, and it affects the way they view the world. It affects, you know, how they relate to other people and how they feel about themselves on a day-to-day basis. So when I, you know, can see people with different kinds of skin conditions and help them, you know, clear their skin or work to manage their skin condition, it's not just, you know, solving some kind of a medical mystery, but it's also, you know, addressing not just their physical health, but also their emotional health. And that, you know, that to me is very meaningful. And, you know, we try to like help people feel better about themselves, you know, and overall improve their general wellness. So acne is a really good example of that, because it's not only super common and like many people suffer from it, but it's also something that it's most prominent on the face for many people. And it's something that, you know, the face is what you present to the world around you. So that's part of what we'll get into, but that's part of what that massive impact that acne has on an individual is, you know, based on that. So so tonight we'll get into trying to, you know, understand the basics of acne and figure out, you know, why it's such an issue. And I think these are the first steps to, you want to get a good understanding of that before trying to figure out how to treat it, which will be covered by the next presenter. So at this point, you're probably all wondering why you're looking at a blown up picture of some ice cream bars over here. Not just because it's one of my favorite treats. These I always have like a big stash of Haagen-Dazs bars in my freezer. But ever since becoming a dermatologist, now whenever I look and I unwrap one of these Haagen-Dazs bars, I just think about acne. That's like the first thought that comes to my mind. I hope I mean, I didn't ruin it for myself, but I hope I didn't ruin these bars for you guys. You'll probably still enjoy them after the presentation also. We'll see. So there are a couple of questions. I'm going to try to advance my slide now and see if that works. This will be the test. Does it work? Yeah. Okay. So a couple of questions that are really common that I hear about acne from different patients all the time. And so I figured this would be a good framework to base the presentation on. So we'll cover, you know, what acne is, why is it so hard to define what acne is? Why do we care about acne? And that leads to why we actually treat it as dermatologists. Then we'll get to what a working definition of acne actually is. And that will follow with some potential causes for acne. And we'll try to bring it all together and figure out how does this information, how can it help you going forward? So to start with, acne is a broad term. It encompasses a lot of different appearances, or a lot of different definitions that people might think of. If I were to ask the crowd, what is acne? I'd probably get a wide variety of answers. Maybe some people would say like pimples or something along those lines. And everyone would probably, think about either themselves, their own acne, or someone else with acne, someone that they know, because pretty much most people either have acne or know somebody who does. But everybody has it a little bit differently. Like no two people's acne are exactly alike. And so that's part of what makes it so hard to define. So if you just look at some of these numbers here, acne affects tens of millions of people every year, and that's just in the US alone. So this is like a really large scale of what this condition actually is. And it affects people of all ages, notably people in the teenage years. That's you could see from here that about like 85% of people between 12 and 24 years of age are affected by acne, which is a crazy number to think about. That's like most people, most teens, most adolescents. And it's actually interesting because if you go into the textbooks about acne, we actually consider this a normal part of development because it's so common in this age group. It also exists in younger kids as well. And of course, it doesn't always go away. And sometimes it starts new after the teenage years. But those numbers that you're looking at are still pretty high. That's like a third of women in their 30s and a fifth of men in their 30s. That's still really, really high. One out of every 5 men or 1 out of every 3 women. And those numbers slowly get lower as you go up in age. But this is just to show you how this scales up, and it's such a broad topic, and so like millions of people are affected. And that goes back to how everybody has it a little differently. It would be impossible for all these millions of people to have exactly the same acne. And that makes it really hard to come to a definition, to just one definition, because it's affecting millions and millions of people. But that's what we're going to try to do tonight. And getting back to, this is a really big condition. It's super common. Maybe not as well understood by everyone. But what we can say about it is for most people, it's rarely life-threatening. And that would be like pretty rare for it to be life-threatening. It can happen, but not really in the most common scenarios. So why do we care about it? Why do we treat it if this is not like a dangerous condition for most people? And for me and for a lot of dermatologists, I think we all are pretty cognizant of how acne affects people on an emotional level. It's not just some medical condition that you read about in a book or see a picture of. This is something that it deeply affects everyone's life, especially in teenage years. These issues that you're seeing here are even more meaningful to teens in some ways, but this could affect anyone at any level. This affects everyone like in a really visible way on a day-to-day basis, and this is what a good dermatologist is aware of this, and most of us are. When a patient comes to see a dermatologist, this is something that is important to keep in mind, because this is the reason why we're treating the acne. And so we talked about how millions of people are experiencing acne on some level, and the major impact that it has on everybody's life, or most people's lives. But that in and of itself is part of what makes it so hard to recognize, to identify, because it's being experienced by so many people on such a high level. So we're going to try to break this down and shed some light on what exactly acne is, and try to figure out a definition we can all relate to. And then, let alone trying to fix it, I'll leave that to the next presenter. So acne is, it's a disorder of the hair and sweat glands. And that is a broad term, but we're going to break it down. But basically, there's a really wide clinical spectrum that acne can manifest as. So you can have someone with the most mild acne and just like a few whiteheads or blackheads, as people, will refer to them as. And it could also range on the other end of the spectrum to really severe illness. But like I mentioned before, that is more of a rare manifestation. It's usually somewhere in between the spectrum. And it's usually found on the face, on the upper chest, the shoulders, the upper back. Those are the most common locations. And that's based on where these specific type of sweat glands are most commonly found, just based on our anatomy. So this picture is just a diagram of what we call a hair follicle, which is where a hair grows out of the skin. And some people know this already, and some people might not realize, but where all of our skin is actually covered in tiny, tiny little hairs. But they might be so small you might not even see them. Some people you can see them, but some not. But this is where the acne originates from. And so if you look all the way on the left of this picture, you can see where the hair is growing down into the skin. And for some reason in acne, this hair, and where you could see the yellow blob over there is where the sweat duct is, and it leads right into the hair. And for some reason, it gets a little bit plugged. The opening to the skin gets a little bit plugged, and when that happens, dead skin and other debris can kind of build up in there and balloon downward. And if that balloon gets too filled, and if it ruptures, then that leads to, some more inflammation, which is basically just your body is recognizing that there's things that don't belong in there, like dead skin and debris. And your body doesn't like that. It's trying to get rid of it, but it just wreaks a lot of havoc trying to do so. But that's where we're going to talk about on the next slide. I'm going to show you, a different spectrum of acne, of how we see it. And, we can kind of correlate that if we keep this diagram in mind. When it gets all the way to the right picture of this diagram is when, the skin gets really angry and the acne is really inflamed. But more towards the left is when a person just has mild acne. Now, the real question mark is on that first picture on the left. We have a pretty good understanding of why, of how this whole process happens, all the chemicals involved, all the molecules involved, but it's really hard to actually pinpoint why that first event is occurring. Why is that acne bump starting on this person or that person in that spot? That's really the toughest question to answer. And, scientists could, think about it all they want, but it's really hard to come up with one solid, definitive answer. So instead, we just have, a bunch of different hypotheses. That's the best we can do, make a good educated guess. So that's what we're going to get into in a moment. And just to show you here, this is that spectrum, just a basic spectrum of acne that you might see in most people. All the way on the left would be like more mild acne, a lot of whiteheads, blackheads, but you see some of the bumps there are starting to turn a little bit red and angry. And then in the middle picture, that would be more of like a moderate case of acne, where that person is probably having more pain around these bumps. They're more red, they're deeper. You may not be able to, appreciate that just from the picture, but these do look a little bit deeper, and they're probably more painful and leave behind more, discoloration or scarring. And that only increases as you go to the right side of these pictures. where it just gets a little bit more severe, a little bit more angry looking, deeper, and you could already see some scars in that area. So, we're trying to figure out what is acne, and this, we talked about, it's a disorder of the hair and the sweat gland, how they work together. Something's not right, but it's really hard to pinpoint it. So we're going to talk through like 3 myth busters, just to kind of get a sense of what patients are thinking and what dermatologists are thinking about these issues, to try to come to some kind of understanding of why is all happening. So the first one, I've heard from like a bunch of people, how people think that, if their face is dirty, that might lead to like more severe acne, or that might, start the acne happening. And some people try to like scrub a lot or wash their face really aggressively to try to, in the hopes of trying to get rid of the acne, or just, make it a little bit less severe. But, in reality, it's not actually as much related to hygiene or cleanliness at all. And actually scrubbing the face really hard is more of an irritation to the skin. It doesn't really help as much as people think, and it might actually make the acne worse. We always try to be as gentle as we can with people's skin on the face, with acne especially. And we usually avoid any kind of scrubbing really aggressively like that. We think, it's more along the lines of having to do with people's genetics. That's more of the case for people who have acne, and we do see that it does tend to run in families. People probably notice that, and less so related to hygiene and cleanliness. The second mythbuster, was actually, it makes me think of my a really good friend that I have from back in grade school, and I remember that very clearly. We were like 12 years old, and she had a pretty bad acne, one of the more severe acne, in our whole grade. And she was telling me that she was told to avoid any kind of greasy foods because, eating oil will just make your skin more oily. And she didn't want to, worsen her acne at all. So she basically cut out all French fries and pizza, like trying to smush out all the oil from the pizza if she had to eat it, and avoiding all fried foods, anything like that, avoiding like oil on her foods, things like that. And it was really hard to watch that happen, because cutting out all this food, and it wasn't really helping her acne all that much. So when we look into, studies that have been done about acne, the link between diet and acne is not really nothing is really so well proven. Really, the most anyone could really say at this point is that there may be a weak link that was seen between dairy as a food group and like more severe acne. But these studies, overall, they were pretty small. They were not actual like interventions that were done where they divide into groups and told people, you only eat this and you eat no dairy, you eat dairy, and then follow them as they go through a study. It was more of just like observing people who are eating these types of diets in general. But, those kind of studies are really hard to control. Diet studies in general are really hard to control. So it's really hard to make any conclusions based on all that. So, it's hard to say for certain that dairy even causes acne at all. That's just the most of a link we found, but it might not even be it might not even be all that true. So take it with a grain of salt. There's other people say other things about diet and acne, like whey protein supplements or like glycemic load, but those have even weaker evidence than dairy. So it's very controversial, and we generally don't, we're not going to advise people to cut out certain food groups unless there's a really good reason to. So the third myth buster that I'll talk about is related to moisturizing. A lot of people come in and whenever we broach the topic of like, oh, adding on a moisturizer, everyone's like, oh no, but like if I moisturize my skin, won't that cause more acne? And really a lot of people have been asking me about this. And I think that this is something this is something that people really think a little bit differently once they come out of a dermatologist's office, I think, because you know, the next presenter is going to get more into treatment, but many of our treatments do involve an element of moisturizing. It's just specific moisturizers are better than others, but it's not that all moisturizers, you know, will cause more oily skin or will worsen the acne. If anything, from a dermatologist's perspective, there's more there's more of an influence of hormones causing the oiliness that people are experiencing on their skin. And this is kind of a twofer because it does relate back to what I was talking about, genetics. It's a little bit hereditary, you know, how many oil glands people have, how active they are. That's all controlled by hormones, which are in turn, you know, related to your genetics. But that's also, you know, a good support for why so much of the acne that we see is in teenagers, where the hormone levels are way different than in any other age group. So, and it's always something that we think about whenever we have patients with acne, especially with female patients. We always will ask about about different questions relating to the hormones, because that does have an effect on how we think about their acne and how we approach treating it, which, like I said, I'm not going to get into now, but I wanted to provide this foundation for you so you can appreciate the next presentation. And you know, this is just you know, that was mostly covering teenage acne, general acne that you see you know, in most people. But just so you guys are aware, there are other types of conditions that may be mimicking acne, and to some people's eyes may look identical to acne. And that's also part of what's so confusing about this topic, is that, you know, if you start defining acne as just a pimple, well, then there's a lot of these conditions that do also look like pimples. So that's why it is important to also understand that there are conditions that can look similar, but are actually completely different and are managed completely differently. So for example, if anyone has like certain underlying medical conditions, like polycystic ovarian syndrome, for one example, that could lead to more severe acne that's more stubborn to treatment, and it's managed differently. And it's usually managed in conjunction with endocrinology, because they play an important role as well. But for those patients, you know, let's say, for example, hormonal treatments are going to be really important because that results from an imbalance in the hormones. So that's something that we keep in mind whenever patients come in. We will ask certain questions to see if, you know, if we're suspicious for this condition or anything else. And then moving on, you can see that in some of these other pictures that I included here, some of these pictures might look similar to the acne bumps that you saw before, but actually that picture that you see in the middle there, of some red bumps on the chest, that's actually induced by some medications. There are some like steroid medications that can cause an acne-like eruption. There are some chemotherapies that could cause acne-like eruptions, and there's many others as well. So that's just an example. And then on the bottom row over there are 3 pictures that also may look similar, but the first one on the left, you know, it may remind you of those red acne bumps that we saw before, but that's actually a picture of rosacea, which is another really common condition, but it is totally separate from acne, and it's actually treated completely differently. And the picture in the middle is a picture of somebody's back, and they have all these, again, red bumps that you see. But this is actually something called folliculitis, which is, it may look similar to acne, but it's actually a different issue, and it manifests a little differently. So the third picture on the right is a picture of somebody's face, and you could see these little skin-colored or pink bumps, and they're more centered around the nose and the cheeks, like in the middle of the face. And those, although they might resemble acne, they're actually a different entity. It's called angiofibromas. And when patients have a lot of them, then, we start to worry about different genetic diseases, or different genetic syndromes, but that's very rare. That was just an example. So you can see that, there are times when, acne isn't just acne, but it may be sometimes hard to tell the difference. And that's, like I said, it's part of what makes acne such a confusing topic. And, we're trying to break it down for you today. And, hopefully, having this kind of basic understanding of acne, like, we talked about, after we talked about, why it's important to recognize it, talking about how it originates from, where the hair grows and the sweat gland and how they grow out together, and how it gets started by some kind of blockage. And then there's different, thoughts about why that may happen. So hopefully, getting some kind of understanding of this will help everybody, recognize what they have or what somebody else has. And, then if you need to see a dermatologist, at least you'll have some kind of a background to, understand better what they're thinking, and help you to work together with that dermatologist to come up with a good plan that actually works and it's tailored for you, to help you deal with your own, individual acne. And happy to answer questions at the end of this presentation. And so we could move along to the next speaker. Thank you so much.
Thank you so much, Dr. Wertenteil. That was really interesting and informative. Next, we have Dr. David Khalil. David Khalil is a board-certified dermatologist in private practice in Manhattan. He specializes in medical dermatology such as acne, psoriasis, eczema, mole checks, and skin cancer, as well as cosmetic dermatology such as Botox, fillers, and chemical peels. He completed his studies at Princeton, Einstein, and Yale University. Please feel free to reach out to him with any questions at info@dkdermatology.com.
Thank you very much, Dr. Wertenteil, for that great talk, and it really sets us up well to talk about the treatment of acne. I'm David Khalil. I'm a dermatologist in Manhattan. And the goal of my presentation here is to talk about how to treat acne and when to see a dermatologist. I tried to really focus on the pearls and to really simplify the treatments for acne. There are a lot of treatments, but there are several that we've been using for a while and are really, really good and are generic and are covered by most insurances. So that's what we're going to talk about. So there are three broad treatment categories. So the first is topicals, prescription topicals like retinoids, benzoyl peroxide, epiduo forte. These are creams that you apply to your face, no pills, very easy to do, very effective. There's some new treatments in this category that really, really work very well. The second category, if that's not sufficient, is antibiotic and hormonal pills. So these treatments are a little bit stronger. If you have a little bit more acne, we use these treatments. For example, doxycycline is an antibiotic pill. Spironolactone is a hormonal treatment that we use. In general, we're moving away from using antibiotic pills or using them for the shortest possible period of time. Hormonal pills we can use for longer, for months or years, and we'll talk more about it. And then the third strongest treatment that you may have heard about is Accutane. The generic name is isotretinoin. So that is the strongest treatment. It works the best. it does have rare side effects, and it is a commitment. It's a pill every day for about 5 months. So we only use that treatment if we need to. Okay, so the first treatment category we'll talk about is topicals. So the number one most effective topical, we've studied this quite a bit in the field of dermatology, is retinoids. Retinoids. They work really, really well. They exfoliate the skin, they peel the skin, they unclog your pores, they bring fresh new skin to the surface. They both treat your current acne and they prevent new acne. They also improve discoloration and scarring. So if someone has significant acne, or in certain skin types, when an acne lesion resolves, you can have like a little bit of brown discoloration, or you can even have scarring. And retinoids actually help with them, help a little bit, but they do help with them. And it's also anti-aging. So it's a good treatment. There are many retinoids. Retinoids have been around for decades. The most common one is tretinoin, also known as Retin A. There's also adapalene, differin, and Tazorac. So retinoids work really, really well, but the key to them is to know how to apply them. So you don't want to overuse them. They are incredibly strong. They come in different strengths, so it depends on what strength your dermatologist prescribes, but they are very, very strong. They are probably the strongest topical, or they are the strongest topical acne treatment. So you just want a pea-sized amount, literally, one tiny dab for your whole face. You want to start slowly. So every other night for the first 2 weeks, let your skin get used to it. And then after 2 weeks, if you're doing well, you go to every night. Again, the key is to go very, very slowly with retinoids. If you go too fast or put like a thick layer of it on, it can really make your face very, very, very red. It can cause peeling, dryness, irritation, or redness. It's not an allergic reaction. It's the way the medication actually works. The medication peels your skin, exfoliates your skin. If going even slowly, you get that, just take a night off. There is no rush with retinoids. They take weeks to work, and so it's really a marathon. So just go very slowly with it. If you do get too red, too dry, too irritated, take a night off. Retinoids should be stopped before any major procedures to the face. Like if you're getting chemical peels or lasers, you want to stop the retinoid. It does make you a little bit more sensitive to the sun. You're going to be applying it at night before you go to sleep, so you won't be getting sun. But the next day, you're a little bit more sensitive to the sun. So sunscreen, which we should all be using, and it shouldn't be taken while trying to conceive, pregnant, or breastfeeding. Okay, so retinoids are the number one most effective topical in general for the average person. The number two most effective topical is benzoyl peroxide. Benzoyl peroxide is antibacterial. So one of the major contributing factors to acne is bacteria on the face, specifically called P. acnes. So benzoyl peroxide eliminates P. acnes. It works really, really well. And there is no resistance to it yet, thankfully. So no P. acnes bacteria has become resistant to it. This is very important. There's actually many different topical prescription, antibiotics. Like, for example, clindamycin is another common one. However, the bacteria have developed resistance to clindamycin. So for some people, clindamycin doesn't work because their bacteria is resistant. But benzoyl peroxide should work for everybody. On average, there's no resistance to it yet. So that's really a good point of benzoyl peroxide compared to the other topical antibiotics. It used to be prescription only. So when I was, your age, a teenager, it was prescription only. Now it's thankfully over the counter. You can get it on Amazon, the local pharmacies. A good brand is Panoxyl. Just be a little bit careful. It does bleach things a little bit. So if you put it on at night and you're going to sleep on your pillow, it might turn your pillow a little bit white. So try to use, a pillow with a white covering. Okay, so these are the two best topicals, retinoid and benzoyl peroxide. We used to have to prescribe them separately. Benzoyl peroxide is pretty strong. So it would actually deactivate most retinoids. So we used to have people put the retinoid on at night and the benzoyl peroxide in the morning. Thankfully and amazingly, a retinoid was developed, a specific one called adapalene. This is the only retinoid. There are many types, but this is the only one called adapalene that is not deactivated by benzoyl peroxide. So you can actually put the retinoid and benzoyl peroxide, the two best treatments, on at the same time right before you go to sleep, and they'll both work without deactivating each other. And thankfully, there's now one product, one prescription, one gel called Epiduo Forte that combines both of them. So you just put this one gel, and we have a picture of it here. You put this one gel on at night, just one pump, a pea-sized amount on at night, and you're getting the two best treatments. Epiduo Forte used to be brand name only, used to be like $500, $1,000. Now it's generic. So most people can get it, works really, really well. This is one of the most common topicals that I prescribe for acne. It has worked really well. It's really a pearl. So this is, I think, one of the most important points about my talk so far today is Epiduo Forte works really, really well. I've had some patients that I thought, they're going to need antibiotic pills, or they might even need Accutane, and Epiduo Forte worked really well for them. And thankfully, we didn't have to move up the ladder and use stronger treatments. Okay, in terms of stronger treatments, so the next category is antibiotic and hormonal pills. So these are treatments that are usually done in conjunction with the topicals. So that's an important point. You still want to try to use the topicals if you can, because that usually means with these antibiotic and hormonal pills, because that usually means you can use a lower dose of the antibiotic or a lower dose of the hormonal pills. The lower the dose with these pills or systemic treatments, the better in general. So antibiotic pills work well in the short term. However, they are not a long-term solution. So in the past, we used to give people antibiotic pills for many, many months, maybe even a couple of years. We have moved away from that. Antibiotic pills work really well for acne. They clear you, but they also eliminate good bacteria. So the human body has a lot of good bacteria that actually helps us digest food, helps with our just our overall internal health. And taking antibiotic pills eliminates that. It also leads to resistance, and then bacteria, will become resistant to it. So now we try to use it for 1 to 6 months in total. I try to use it, 1, 2, 3 months, and really not even go past 3 months if I can. So it's a good treatment, works really well. We just want to be cautious with how we use it. The most common antibiotic for acne approximately is doxycycline. It works really, really well. It's well tolerated overall. The full dose is 100 milligrams twice a day. We don't prescribe it often, again, because it's not a long-term solution. But if someone has like a major event coming up, like they're getting married, they need to be clear in a few weeks, they want to know that they're clear, that they will be clear. So then we would use the full dose. Thankfully, there's also low-dose doxycycline, which is 20 milligrams twice a day. And we've studied this quite a bit in the field of dermatology. If you're at this low dose, you're going to get less improvement of your acne because it's a lower dose, but it actually doesn't cause antibiotic resistance, and it doesn't eliminate good bacteria at this low dose. So if a patient's on topicals, for example, their acne is better, but they want a little bit more improvement, maybe 10, 20% more improvement, then we'll add the low dose doxycycline, and they'll get that little bit more improvement. And they can be on the low dose longer, since as best we know today, it doesn't lead to antibiotic resistance and it doesn't eliminate good bacteria in the body. The human body, interestingly, according to some studies, has 10 bacteria cells for every 1 human cell. So we call this the microbiome. So it's actually very interesting. There's a lot of normal bacteria in our stomach, in our gut, on our skin that actually helps the body function. So it's a very interesting new field that we're learning a lot about. Okay, doxycycline, like every pill, like every medication, has some rare side effects. So it does make you sensitive to sunburns, particularly if you're on the full dose. So you need really, really good sun protection. So be careful during the summer. If you're on vacation, you want to be careful with your doxycycline and sun protection. It also can cause stomach upset and heartburn, especially the full dose. And you might not notice this in the beginning, because in the beginning, it's like just starting to cause it and you have a little bit of buffer and you don't feel it as much. But after a few weeks, you can really start to feel it. So what you want to do is take it with food. If you take it with food, it doesn't irritate the lining of your stomach, and don't lay down for 2 hours after you take it so that the pill doesn't come up and give you like heartburn. If you are in a rush, let's say, life is very busy, you're not going to have a big dinner, you're going to go right to bed. And so you're not able to take it with food, or you're going to go to sleep right away and lay down, just skip a dose. When you take antibiotics for acne, it's different than like when you take it for strep throat. There you really want to finish your course. Here, you're able to skip a dose, on rare occasions if needed. Okay, minocycline is actually part of the same family as doxycycline. They both end in cycline, so they're the same family. They both work really well for acne. However, minocycline is slightly different. And because of this slightly different formulation of the molecule, the minocycline, there's a rare side effect with minocycline that does not occur with doxycycline. So only people on minocycline get this rare side effect. It has a long name, drug rash with eosinophilia. These are like allergy cells in the body, and systemic symptoms. Systemic symptoms means like symptoms that affect the body, the internal organs. So like fever, heaven forbid, inflammation of the liver, the kidney, the heart, the brain. It is incredibly rare. It's less than 1% of people, but this can be pretty bad. Sometimes it's mild, but sometimes it can be really, really bad. People can get, high fevers, inflammation throughout their internal organs. So because of this rare side effect, and because there are so many other good treatments for acne, some dermatologists, not all dermatologists, but some, including me, really try to avoid using minocycline. So I'm actually putting this slide in to tell you to be very, very careful with this medication. I almost never prescribe it. It's been several years since I've had to prescribe it, and it's only in rare cases when all the other medicines don't work. Because again, while this is rare, this side effect, it can be quite significant sometimes. Okay, in terms of hormonal treatments, we have spironolactone. So spironolactone is an anti-hormonal treatment. It is not an antibiotic. So we can be on this medicine for the long term because it's a hormonal treatment. It blocks androgen, like testosterone. Men and women have testosterone normally. So it blocks androgen or testosterone receptors in the oil glands. And the oil glands, as Dr. Wertenteil was telling us, is what contributes a lot to acne. So this medication actually works really well for people that have hormonal acne, and even people that don't have hormonal acne, females. It works really well for them in general. Hormonal acne, so everybody has hormonal contributions to their acne. Some people have more. So if you have more hormonal contribution, it's usually acne that's on the chin, the jawline, the neck, and usually it flares a week before your cycle. If that's primarily where your acne presents and it primarily flares a week before your cycle, then you have primarily hormonal acne, which is very common for females. This medication works really, really well, and it's specifically targeting the hormones. I usually still put people on topicals, at least one topical if possible, because the topicals will still help. Because the acne is multifactorial. Even if it's primarily hormonal, you still have a minority component, through the regular way, through extra oil, through bacteria, through issues with hair follicle formation. So I still use this with the topicals, and the topicals I find also let us use a lower dose of this medication. And the lower the dose of these systemics, the better. It is originally a blood pressure medication that was found to have anti-acne effects. So it can actually lower your blood pressure a little bit. So you need to be careful with that. So usually well tolerated. Because it blocks hormones, it cannot be taken while trying to conceive, pregnant, or breastfeeding. It's only for females because, again, for men, it blocks the male hormone. It may make your cycle a little bit irregular. This is usually not harmful, but you want to let your OBGYN be aware. And usually they say, we're aware this is an expected side effect and it's okay. If it becomes too much or too much of an issue, birth control pills are often given, and it helps with this side effect. And birth control pills, as a side note, often also help with acne. And we'll talk a little bit more about that later. And then, as we were saying, it could lower your blood pressure. If you have, your general doctor throughout the years has been checking your blood pressure. And if you have normal blood pressure, there's no issue with spironolactone. Usually you're young and you're healthy. It doesn't usually cause a side effect. If you're like very tall, very skinny, or you just run low with your blood pressure, then you want to be a little bit careful because this may lower you a little bit more. So you want to check your blood pressure before you go on it. And then once you go on it, afterwards, check it again to make sure you're not too low on your blood pressure. If you get lightheaded or dizzy, stop the medication. If you're doing something where you're going to lose a lot of water and lower your blood pressure, like you're running a marathon, just be very careful if you're on this medication. So birth control pills usually do work. They're a hormonal treatment like spironolactone. The major important point and the pearl with birth control pills is that you want to make sure that they're a combination of progesterone and estrogen. You want to make sure it's a combination treatment. You do not want progesterone only. So you don't want progesterone only birth control pills or progesterone only implants under the skin or progesterone only intrauterine devices like Mirena. Progesterone only often, not always, but often flares acne and causes hormonal acne. So it's the combination progesterone and estrogen. And if you let your OBGYN know that you have acne and you want to make sure this doesn't flare your acne, they're usually aware of this and they'll usually prescribe a combination treatment. Okay, the third and last treatment category is the strongest. And this one, you've probably heard about it. Probably some of your classmates are on it. The old name was Accutane. The generic name is isotretinoin. So this is the most effective treatment for acne, period. There is no treatment that is as strong and as effective as isotretinoin. It is the only treatment that when you finish taking it, your acne is permanently improved thereafter. So all the other treatments, all the topicals, the antibiotics, the hormonal pills, those improve your acne while you're on them. And then when you go off it, after some weeks, some months, your acne usually goes back to its baseline. Thankfully, with time, as Dr. Wertenteil was saying, we outgrow our acne. So we often use the topicals or the antibiotic pills or the hormonals to sort of decrease the acne as we outgrow it. But if you have more stubborn acne, more severe acne, and you want a treatment that permanently improves your acne, and it's severe acne or you have scarring, then Accutane or isotretinoin is the most effective treatment. Approximately 50% of people are cured after taking a full course of isotretinoin. A full course is about 5 months, approximately, a pill every day for 5 months. The other 50% approximately have permanently less acne. So 50% of people still have acne. It's just less than what they had before. So for these people, they went in with severe acne and hopefully they finish with, mild or moderate acne. And we may use topicals, which may not have worked for them before when they had severe, or in a small number of cases, we may have to repeat the course of isotretinoin. It's a significant time commitment. It's as we were saying, a pill every day for about 5 months. You have to see your dermatologist every month. There are no refills on this medication. It's actually regulated by the government through an iPledge program, so there are no exceptions. You need blood work approximately every month while you're on it. And for females of reproductive potential, it requires a negative pregnancy test, which can be done through that same blood work that you have every month or through a urine test. Some people think, sometimes people come in, Accutane has a lot of side effects, they say, but actually overall, most patients, if you start slowly, use it in people that need it and work your way up on the dose slowly, most people have no major side effects. People do have mild treatable side effects. So for example, most people will have dry lips. Almost everyone that goes on it gets dry lips. Some will also get dry nose. Sometimes the lips even crack and bleed a little bit. So we tell people to use lots of moisturization. And since we're going up slowly on the dose, that's usually after a couple months, and you can sort of see it and feel it as the lips get drier. And if it's too dry, we can always lower the dose of it. It may also increase cholesterol levels a little bit, usually nothing major or significant. I've never had a patient so far that had a significant elevation of cholesterols. It may increase your muscle enzymes a little bit, especially if you exercise, if you're in sports a lot. So we often, if we do see that, we tell people a little bit less exercise or a little bit less sports. You can still do sports, but a little bit less. It may increase your liver levels. Thankfully, all these things are checked in your monthly blood work. The most important thing about isotretinoin, and the reason the government got involved, is you absolutely cannot get pregnant while you're on this medication. It is very bad for a developing baby. This is while you're on the medication. I think someone wrote into the questions, this is while you're on the medication. So once you go off it, after a month of being off of it, you can become pregnant, and it has no effect on a developing baby after you're off it for a whole month. As you can imagine, a good number of people go on isotretinoin over decades now of use. And most people that go on it, most females that go on it, thankfully, they have children later on with no issues. One other concern with isotretinoin there are these like single, or we call them anecdotal or occasional reports of people noticing mood changes, thoughts about harming themselves, thoughts about harming other people, or issues with their gut, swelling, inflammation of the gut, the medical term Crohn's disease or ulcerative colitis. So people have reported this while on Accutane. As you can imagine, people are on this medication for 5 months and they're a teenager. This is also the time when a lot of these conditions present. So we think it's a coincidence. As best we can tell today, we don't think it truly increases the occurrence. We don't think it truly causes these conditions. We think it's a coincidence. However, since we don't know with absolute certainty, if anyone has a personal or family history of these conditions, we ask that you speak to your general doctor, your pediatrician, your specialist in that field to make sure they're aware that you're going on it and to make sure they're available in case there's any issues while you go on it. One true significant, thankfully very rare, less than 0.1%. I've never had a patient with this side effect, but some of my older colleagues have had 1 or 2 patients during their whole career. So, and we do think this is this one that we're about to talk about, a true side effect, is that Accutane can increase the amount of water around the brain. And then this extra water around the brain can put a little bit of pressure on the brain, and it presents with headache and or vision changes, particularly blurry vision. So it's, again, very, very rare. I've never had a single patient, but we do believe it's a true side effect. If you do have, the most important thing about this is if you do have significant headaches, vision changes, stop the medication, go to your doctor, urgent care, emergency room. They can do a simple eye exam. They can actually see through the eye and see if you have swelling in the head. If you do, you stop the medication. Usually you're followed very, very closely, and usually the swelling goes away and you do fine as long as it's caught early. If you wait, the swelling gets more, and then there can be significant issues. So you want to catch this early. That's the main point, the pearl. Do not take isotretinoin simultaneously with doxycycline, tetracycline, or minocycline, because it may actually slightly increase the chance of this side effect. Usually we are not anyway. When a patient goes on isotretinoin, we usually stop all other acne treatments because isotretinoin works so well, we don't need other treatments. But just alert your other doctors. Doxycycline can be used for other types of medical issues, so you don't want another doctor prescribing it for you while you're on isotretinoin. Okay, in terms of when to see a dermatologist, so acne we treat every day. Every day patients are coming into the office, multiple patients with acne. It's incredibly common. It's one of the most common conditions that dermatologists treats. Many of these patients are coming directly to us for the first time to get an evaluation and treatment. Some have seen their general doctor first and it hasn't worked, so they're coming to us after that. So you're welcome to come directly or after seeing your general doctor. If you have mild acne, your general doctor, your pediatrician can usually treat it with topicals. If you have severe acne or moderate acne affecting your face, your chest, large areas of your back, if you have these large painful cysts, if you have any degree of scarring, interestingly, scarring does not always correlate with acne, so with the degree of visible acne. So you can have mild acne, but have a lot of scarring. You can have severe visible lesions, but have very little scarring. But scarring we take very seriously because that can be hard to reverse later on. So if you have any degree of scarring, that would be a time to see a dermatologist, or pain. As Dr. Wertenteil was saying, if you have any underlying medical condition that predisposes you to acne or any sort of acne mimicker, so polycystic ovarian syndrome, PCOS, it's a very common condition. It's a hormonal condition. There are extra hormones with this condition. 5 to 10% of women have it. You usually have more acne or severe acne. You usually have increased chin hair, weight gain, and you may have less cycles, irregular menstrual cycles. So those are some of the presenting symptoms of it. If you have any of those signs, let your general doctor know, and they will refer you appropriately. Treatment for PCOS is dietary modifications to help with the weight, birth control pills, and spironolactone, because it is primarily a hormonal condition. And then in terms of acne mimickers, so just as Dr. Wertenteil was saying so nicely, so rosacea and perioral dermatitis, they're actually, basically the same condition, the same underlying biology. So rosacea and perioral dermatitis, it's a condition where the center of your face becomes red, as you can see in this photo. So the center of your face is usually red, and you get these little dots, little bumps around your nose, around your mouth, around your eyes. The sides of your face are usually clear. This is a condition that usually affects adults, so 20s and up. It's not usually if you're less than 20. You have redness, you're more likely to blush, and you get these pink bumps. And so we use different medications for this. We use different topicals, metronidazole and azelaic acid. So thank you to you guys, to the teenagers on a Sunday night to tune in and listen to us. Thank you to Dr. Gail Gutman. She's actually the first one that told me about this and invited me. To my co-hosts, Dr. Wertenteil, Tamar, Hadassa, Jackie, and to the association. Thank you for having me.
Thank you so much, Dr. Khalil. So we have a lot of wonderful questions already, but I'd like to formally open the floor to questions. Our panelists for today's Q&A will be everyone who has spoken today. Please remember that this forum does not substitute individualized medical advice, and we will address broad questions. Please also hit the Remain Anonymous button when submitting questions for the Q&A. So some question we got in. What is the youngest age a boy can take Accutane?
So you can take Accutane if you need it. If you have severe acne, you can take Accutane at a young age, 11, 12, if you need it. First, it has to be carefully evaluated. Is it acne and not another condition that's mimicking acne? Generally, we try the topicals first. If the topicals are not working and it's severe, you can take Accutane at a young age.
And someone asks, is it possible to get acne from missing vitamins?
I can take it, or Dr. Sara can take it.
Yeah, so if the person would have like a severe vitamin deficiency, they would have a lot of other signs of that vitamin deficiency that we could actually see on the skin too. And we see those more often than acne, actually. That's what I would say. Like, for example, like skin peeling, sun sensitivity, even things like that a patient would describe like diarrhea, things like that. They would have like fragility or brittleness of the hair. Their nails would also have some changes. So I would say that we see those changes more commonly than things like acne. I don't know if Dr. Khalil has any other insights into that as well.
Yeah, I completely agree. Usually, if you're on a healthy diet, usually if you had a vitamin deficiency, you would have these other signs, significant skin peeling. So usually, as best we know, there is not a vitamin deficiency if you're on a regular diet. However, the role of foods and nutrition and vitamin in acne is a very, very interesting question. And I think we need some more research into that.
What are some options for acne scars when someone has them?
Yes. So acne scars, we try to avoid them. We try to treat your acne as best we can to prevent them from developing. Once a person has acne scars, which is very common, a lot of people develop acne scars. Treatments are chemical peels. So you can put a strong chemical peel right into the center of the acne scar. We call that TCA 100% cross. It's a very precise procedure where we put a little bit of chemical peel right into the depth of the scar. Another common treatment is laser, like Fraxel. Another treatment is chemical peels. And a topical treatment is retinoids. Retinoids, as we were saying at the beginning of the talk, they work for acne scarring. They're just very slow. Over months, they improve it. So there are several treatment options for it, and it's a growing field. We're developing more and more treatments. And Dr. Sara, please add if you want to.
Yeah, sure. I think you covered pretty much all of them. And there's also, I would say, that less expensive but less effective option of the microneedling, where they take a bunch of like tiny little needles. You numb up your face first with a topical, and then they apply a device with a lot of tiny little needles. But although it's cheaper, it's not as effective as some of the ones that Dr. Khalil just mentioned.
And I guess also along those lines, someone asked if Accutane can help with scarring.
Accutane usually treats and prevents acne. It doesn't usually help with existing scarring.
Another question. What is the best topical treatment for acne in young men ages 19 to 25, primarily on the chest and back?
Yes, so a very good question. So on the chest and the back, often bacteria, moisture, and occlusion are contributing to acne there. So you can still use a retinoid, you can still use benzoyl peroxide, but I would say benzoyl peroxide in particular because it's antibacterial. There's another antibacterial wash that works really well that's over the counter as well, called Hibiclens, that can be used on the chest and the back. It should not come into contact with the face because it can be a little bit irritating to the eyes and the ears. as well as just trying to not have moisture and occlusion on the chest and the back. So loose clothing, make sure you're not like laying back right into your chair and giving occlusion. So you just want a little bit more airflow and antibacterial treatments for those areas.
Yeah. And there's other types of retinoids too. Like one of them just got that FDA approval for the chest and back, like a cleaf, but it's all the same thing, like retinoids. They're all similar. So it's just, marketing.
Can a facial cause more acne?
Yeah, I think it depends how the facial is done, because I think facials are done differently by different people. If it's done very abrasively, then it could probably cause more irritation. But if it's done with certain peels, or just extraction of those whiteheads or blackheads, then that in those cases it would not cause more acne. It may just not treat, the underlying acne, the underlying cause of what's driving it. But yeah, it depends how it's done. If Dr. Khalil has anything to add to that.
Yes, I completely agree. Ideally, any treatment to the face, you want to be careful it's done by someone that is, experienced, professional, and that they do it properly and gently. If they're over aggressive with these treatments, it can cause issues.
Is wearing glasses bad for acne-prone skin?
I would think that it's not necessarily bad for acne-prone skin. Most of the acne that we're seeing is actually not like around the nose where the glasses rests. Although that does it does cover up those pores in that area, so that could lead to some sweat trapping. But overall, it shouldn't. There's not that many of those specific type of sweat glands like right around that inner area of the nose, so we don't see as much acne right in that area where the nasal bridge of the glasses rest.
I completely agree, and we're both wearing glasses actually. I think we're both doing okay.
Yeah.
Is it okay to take Accutane while using medroxyprogesterone?
Yeah, which is the Depo-Provera shot for birth control. So that's a type of birth control that's given in like a shot every 3 months. And it's a progesterone only.
Yes, it should be completely okay. In fact, the government wants people to definitely not, and we want, of course, for people to definitely not be pregnant while they're on Accutane. So a lot of people are actually on 2 forms of birth control treatments while on Accutane to prevent pregnancy, whether it's a shot or a birth control pill. So yes, a lot of people are actually on birth control while on Accutane to prevent pregnancy with no issues.
Next question. Are the generics of retinoids just as good as the brand names? She gives example of tretinoin versus Winlevi.
Yes, absolutely. I think Dr. Sara agrees.
Yeah. Although be careful with the Winlevi because it actually has a different kind of mechanism. It's more of an androgen blocker. So I wouldn't, classify it as a retinoid, but I definitely agree with what Dr. Khalil said, that the generics are just as good as the prescription. And like Dr. Khalil had mentioned, one of the examples he gave, like adapalene, that was just a few years ago prescription. So a lot of these are, becoming more and more widely available as generics, but it doesn't take away from their effectiveness.
When would salicylic acid be used?
Yes, salicylic acid is a good treatment for acne. I would put it as number 3. So we had retinoids as number 1, benzoyl peroxide is number 2. So salicylic acid is a good treatment as a number 3. You can use it as a face wash in the morning. It's really good at unclogging pores, especially blackheads and whiteheads. So if someone has predominantly these blackheads and these whiteheads, more so than like the pink, red, enlarged cysts. Salicylic acid would be a good treatment option in the morning. And Dr. Wertenteil, please add.
Yeah, I agree. We don't use it as often as, some of the retinoids and the benzoyl peroxide when we're thinking about topicals. It could also be a little bit irritating for those with more sensitive skin. But it definitely helps fight against, the oil glands and the activity of the oil glands. So that's how it helps as well.
And our last question, is it a myth that Accutane can stunt a young boy's growth?
Usually not. If done carefully, usually not. There were some studies about bone closure and such. Usually we try the topicals first, and usually we only need it we only use it if a person needs it. But usually not. And Dr. Wertenteil, please feel free to add.
Yeah, I agree. I think that we keep that risk in the back of our minds of like, the growth plates closing a little bit early, but that's pretty rare. And we do use it in young teens, even like early preteens if it's absolutely necessary. Although, like, I agree with Dr. Khalil, we wouldn't use it, first line for a really young kid if they didn't need it.
Thank you so much. Thank you so much for everyone for joining us today. We hope this was a helpful and informative session for you. Just a few reminders as we close. If you have any questions or feedback, please email teenhealth@jowma.org. The feedback greatly helps us with our webinar planning. We hope to be able to provide teen education like this multiple times throughout the year. As a reminder, a recording for this session will be distributed to registrants only. And as always, a thank you to the team of JOWMA, our wonderful panelists today, and the Teen Health team for making this webinar possible. Thank you so much for joining us.